Welcome to the Keenan Lake Show on SIBN Radio. Keenan Lake is the author of the book My Daddy Taught Me That, published by Welcome, a social worker and activist. You can like this show's fan page at www.facebook.com/The Keenan Lake Show on SIBN Radio. Feel free to post any comments, questions, or requests for his book on the fan page. Now let's go into the studio with your host, Mr. Keenan Lake, and co-host, Marcus Select.
Well, ladies and gentlemen, thank you so much. Thank you so much for joining us right here on the Keenan Lake Show live on SIBN Radio. We surely appreciate all of those of you that are tuning in live and on demand. And please bear with us as we have been having some technical difficulties in the studio, but now we are set to go. Keenan, how are you?
Doing well, Coach. Doing well. It's a good Sunday evening. Had a great day today, and just getting ready to and happy and eager to talk about the show and the topic today. How about yourself, Coach? How are you doing?
Yes, I'm doing fine. Sweating a little bit here in the studio, but I'm gonna make it through.
Yeah, that goes. So first of all, folks, I want to say thank you again for tuning into the Keenan Lake Show. Want to say happy Black History Month to all those who are viewing and listening to the show. I think this is our first show, Coach. We didn't get a chance to do one last week because of my illness. I was kind of sick and under the weather, so I'm so glad to be here to talk a little bit about Black history in the upcoming weeks. But, Coach, I have a really, really good topic today that we're going to talk about, and basically it's about the Affordable Care Act, and I have a great guest speaker. Her name is Diane Caldwell, Mrs. Diane Caldwell, and she's actually employed with Physical Legal Services here in Asheville, North Carolina. So, Mrs. Caldwell, are you on the line now?
I'm here, Kanan, just waiting.
Okay, great. We're so glad to have you. So, Coach, if you're ready, I'm ready to dive right in and get some things talked about and fleshed out.
Well, Diane, thank you so much for joining us. We know your time is valuable, and we're anxious for our listeners to hear what you have to share. Kanan, I'll throw it over to you.
All right. So, Mrs. Caldwell, first of all, for all those, I think most folks know the Affordable Care Act by Obamacare. So can you explain a little bit about the Affordable Care Act? Because I don't think a lot of people know exactly what it is, what it does, and how it affects us all.
Yes, Ken, I'd be glad to. And first of all, thank you for allowing me this opportunity to be on the radio show. We're trying to get the information out into the general public as much as possible. We're running out of time. The deadline date for the enrollment is March 31, and so we want to take advantage of every opportunity, every window open in order to get this message out and to help people understand about Affordable Care Act, a.k.a. Obamacare, because most people don't understand exactly what it is. So giving me this opportunity is going to make a lot of difference, hopefully, for a lot of people. Now, your first question was Obamacare, Affordable Care Act. As you know, the president, and it was signed into law back in 2010, March of 2010, that everybody deserves to have health care. And so during the process of putting Affordable Care Act together, it was originally intended that every person would have health care after the bill was signed into law. As you know, it didn't turn out that way. At the beginning, the Supreme Court said, yes, everybody needs to have health care, and we're going to make it so that everybody does across the board. Young, old, it doesn't matter. You will have health care, even if you had pre-existing conditions. However, it was challenged and went back before the Supreme Court. And at that point, the court said that every state should have the right to say whether or not they would do extended Medicaid. And unfortunately, many states chose not to extend Medicaid, and because they didn't, it caused a lot of people not to be able to have the care that they so much deserve. And unfortunately, again, one of those states is the state of North Carolina. Governor McCrory said no to the expansion of Medicaid, and so it's causing a little more than 500,000 people to be without health insurance and health care.
So Mrs. Scott, real quick, Mrs. Scott, you said 500 people.
500,000.
Now, is that just in the state of North Carolina?
State of North Carolina, yes.
500,000 people without health care in the state of North Carolina. That's insane.
The state of North Carolina, yes.
Yeah, that's insane. So, okay,
I
so
think
now
Georgia
that we know a little bit more.
I think Georgia follows suit with that as well, Ms. Cardwell, that we have not also... Right. Mm-hmm.
Right, and 26 states did, and the rest of the states chose not to.
Wow. So if it's 500,000 in just this state, it could be that and exceeding that in other states as well.
Exactly.
Yeah.
And what that means is that, people will be able to go to the emergency rooms, and they will be able to go to the free clinics and other healthcare places where they might be able to be seen on a sliding fee scale. But that does not negate the security that people would have if they had their own healthcare plan that they chose and that they were able to utilize at will. Even though they will be able to go, one of the things that the healthcare plan anticipated was that people would not wait until it was a have-to case to go to the doctors, but that instead they would go for annual checkups and go for the preventive type services rather than have to wait until it was an absolute necessary thing to see the doctor or go into the hospital, when unfortunately sometimes it can be too late.
Wow. So, Mrs. Caldwell, who exactly does this affect? Because I know the enrollment date, you said it earlier, that the enrollment date is coming up on March the 31st. So, who does this affect, and what happens when we don't get enrolled, or when people don't get enrolled in basically the enrollment?
It affects all of us across the board, Keenan. And one thing I definitely want to make mention for the general public that will hear your radio show, so many people are afraid and they're aggravated and disappointed, of course, and they don't know what to do because they feel like they're being forced to pay a $95 fee if they choose not to enroll. Well, I want to make it very clear that enrolling actually can save you from paying the $95 fee in two ways. Number one, if you feel like you cannot afford the insurance, if you don't have the money or the means to cover yourself in an insurance plan, then you can file papers and apply for the exempt status. And if you can't afford it, you're not going to be forced to pay something that you don't have to pay. And I really want people to understand that. Go see a healthcare navigator, talk with them, and ask them to download a exemption form. You have to fill it out and mail it in. But there is that possibility. The other thing I want people to understand is that people are under the misinformation that so many people are going to have to pay $500, $600, $700 a month for insurance. Now, I'm not going to say that people won't have high insurance. In some cases, mostly not. But the good thing about it is that so many people will fall into a income guideline that will help. Whereas the government will pay a huge portion of their insurance for them. I had one lady. She didn't want to enroll because she was afraid that she couldn't afford it. And then when she enrolled, she realized that she only has to pay $6 a month. Another lady only has to pay $17. It depends on the choices, and there are 4 categories. There's bronze, silver, gold, and platinum. It's all your choice. Basically, what a healthcare navigator does when you to see them is sit down and talk with you, tell you what the Affordable Care Act is, tell you how it's going to affect your life, show you the different plans. You get to choose your premium, and then they give you all the information you need to make an informed decision about your health care needs for you and for your family.
Very good.
Okay.
Now, these healthcare navigators, how do they access those that respectively at their areas or zip codes and communities?
We of course go on healthcare.gov. That's healthcare.gov, and any individual is more than welcome to go to the same site. We go there and we sit with the consumers and we show them what's available to them. They get to see how it works, what the plans are, what the different plans are, and how much they cost. They get to choose which plan they want out of the 4 categories, and then there's some additional things that they get to see as well. We are in the process right now, thanks to DHHS, we're in the process right now of going into several of the housing complexes. We're going into Pisgah View, we're going into Hillcrest, we're going into Swananoa Valley Christian Ministries. We're doing several of the, and then we're doing a BIPA. We're going into several different sites in order to make access easier for the people that live in these different areas, so that we can make every possible availability to them so that they don't have to worry about paying those fees. And by the way, Tina, most people hear the $95 and they miss the other portion. If you don't enroll and you in the position where you have to pay, it's not just $95, or it could be, it's $95 or 1% of your annual income. And so it could be $95 or higher. And then if it's $95 for each per adult, $47.50 per child. Now, most people, if they go into the office to talk with the navigator, they're going to find out that they really don't qualify. They really are not in a position to have to pay that money. And that's what we want them to understand. They don't have to be afraid to come in and talk with the navigator. They don't have to apply. They can just come in, talk with the navigator, meet us at some of these places that I mentioned, talk with the navigator, and find out what the process is, take a look at it, and then the decision is up to them. We're not there to force anybody. We don't sell insurance. That's not why we're there. We're there to help people to know what's available to them, how it can affect their life, and help them to see how they can make the choices that's best for them and their families.
All right, so folks, for those who are listening and those who tune into the Kingdom Lake Show, those places again were Pisgah View, Diva View, Hillcrest, BIPA, and what was the other one, Mrs. Caldwell?
Of course, Pisgah Legal Service Office on 62 Charlotte Street.
So, folks, those are places where you can go get assistance. Again, when we come back from commercial, I got a couple of more questions that I would like to ask you, Mrs. Caldwell, so we can get more of this information out. But, folks, again, if you have any questions about the Affordable Care Act or Obamacare, please go to some of these places. Please seek out the help, because this is something that will affect us all. Coach?
All right, we're going to go to a commercial break. You're listening to the Kingdom Lake Show on SIBN Radio. We'll be right back after the break. Stand by.
Responsible, accountable. Who taught you that? My daddy taught me that. That's right, the new book, all the way from Asheville, North Carolina, representing the legacy of Benny Lake, is Keenan Lake, the author of My Daddy Taught Me That, the book and the program for young men in Asheville, North Carolina, and throughout the region. Tune in to the program, the project, and the book at mydaddytaughtmethat.com. For more information, email lake@mydaddytaughtmethat.com or call 828-582-2261. That's 828-582-2261. mydaddytaughtmethat.com. Radio.
And you have just tuned in to The Keenan Lake Show. I'm your host, Keenan Lake. I am a published author, book My Daddy Taught Me That, a public speaker, and the president of a men's development youth program. The purpose of this show is to create awareness on topics that are dear to my heart, primarily absent fathers, male role models in the home, youth and young adults and children, families, and neglect and abuse. I not only want to shine a light on these topics and create awareness on these topics, I want to educate, inform, encourage, and motivate. So please join us on The Keenan Lake Show. For more information about The Keenan Lake Show, give us a call at 415-967-2346. And we thank you for listening to SIBN Radio.
All right, we're back here, the Keenan Lake Show, live and on demand, understanding the Affordable Care Act. Thank you so much for listening and stopping by. Don't forget to tell a friend and follow Keenan on the social media networks. We'll have more information about that as we progress on. Keenan?
I'm here, Coach.
Listen, earlier she talked a little bit about the healthcare navigators. I want her to go back into that because, as she said, there are going to be a lot of questions, and the healthcare navigators, from my understanding, is there to help answer those questions as well as match the person according to the law's sections or entitlements, however it reads out, to the person's income qualifications. And I'm assuming now that they are going according to the tax code and the tax documents or data for that individual. When you type that person's name and social security number in, if they've made $75,000 or $7,500, whatever the case may be, information will come up based on questions asked. But I want her to go back into the navigator situation and how it is beneficial at this point in time, early before the deadline, to talk to a navigator. Can we do that?
We can do that. And as a matter of fact, I'm glad you brought that up. Going back to a navigator, we were trained. We are trained navigators. There are 4 on staff at Physical Legal Services, and there is approximately 85 navigators with Physical Legal Services. So we have people that are able to, take care of the needs. Now, one thing I want to make sure that I do before I talk much more about that is to give a number. These people, any person, is more than welcome to call the 1-855 number, and they can get their questions answered. That's where they will need to call and make the appointment to come in and talk with the navigator. And that number is 855-733-3711. Again, that number is 1-855-733-3711. That's the number where you would call in order to make an appointment to come in and see a navigator. And once you call and make that appointment, you can tell them over the phone what area, what particular place you would like to go, whichever place is closer to you and most convenient. And we have people at remote sites that will be in several of those places and others that people will be able to go to. So when they call in for their appointment, they can tell the person that will schedule that appointment for them what site they would like to go to that's closer and most convenient for them. Now, going back to the navigators. Navigators are trained, and yes, the training and the information ties into, it's a federal government program. It does tie into your income taxes. It's based on your 2014 projected income. Many people have felt like when they file their taxes this year that they're going to be facing that $95 or more, 1% of their income on their tax return this year, which is not true. This year, you're actually dealing with your 2013 tax return, and so you don't have to worry about the 2014 return until this time next year, which is 2015. So these taxes, these fees or penalties will not come into play until the end of 2014, which is why we do everything based on a projected income, not an actual income, because people don't know their actual income until the end of 2014.
And I'm glad you mentioned that, Mrs. Caldwell, because I think what I wanted to find, there's two questions that I want to ask too. The first question is, because I want the folks out there to know, like, for example, I work for a county entity or a government entity, and my health care insurance is paid for. So for folks who have their health insurance paid for, would they still need to enroll? Would they still need to have to sign up? Stuff like that.
No.
That's the first question.
No. You don't have to. If you have insurance and you're satisfied with the insurance programs and plans that you have in place, you don't have to enroll. People on Medicare don't have to enroll. They don't have to worry about it. This is basically people who are without insurance. Mm-hmm. If you have insurance now this gets a little bit more technical, what I'm getting ready to say now, and it might be a little more complex for some people. But if you have insurance through an employer, and if your insurance is costing you more than 9.5% of your annual income, then the federal government is saying that that insurance is too high, too costly, and you are subject to, if you choose, to go outside of your employer and go into the marketplace and buy insurance. And because it's complex and technical, that's another reason for people to talk with a navigator, because they will be able to help them to know. Some people can just sit down and say, okay, I make $50,000. If I'm paying more than $5,000 in health insurance, then I'm paying too much. Let me see what it will cost if I go through the marketplace. Right now, the marketplace insurance is only covering insurance through Blue Cross Blue Shield and Coventry. In Henderson County, it's only Blue Cross Blue Shield. In other counties, it's Blue Cross Blue Shield and Coventry. So you have choices, and you have different plans that you can choose from. One of the other things I want to make known as well, some people have found that their insurance have increased to a small degree. That's because in the prior years, when you had your insurance plan, you didn't have all the benefits that you now have. Every insurance company in the marketplace is required to have 10 essential benefits. Before, that was not the case. Every insurance agency in the marketplace now, you can't be disqualified because of pre-existing conditions. So many people have been disqualified. Their insurance have dropped them because they have a pre-existing condition. That cannot happen anymore. If you reach your maximum out-of-pocket and cost sharing amount, then the insurance company in the marketplace has to pay the rest of your medical bill for that year, regardless of the amount. So these are things that are in place now under Affordable Care Act, a.k.a. Obamacare, that was not in place prior to Affordable Care Act. And so these are things that people need to know and be aware of and understand that, yes, it might cause a little bit of difference in your, or some increase in your health care, but you're getting a whole lot more than what was available to you before.
Great. Coach, I think you had a question you wanted to ask.
Yeah, the 1-855-733-3711, is that respective to Asheville, North Carolina, or is that a general navigator number?
That is to the state office, because they do all the appointment scheduling. It's their way of tracking how many people are going into the system to access affordable health care. And so they schedule the appointments for you. Mm-hmm. And then what happens is when you call in, they schedule the appointment. They ask you, where are you located? If you know where you would like to be seen, then you tell them where you want to go, either Physical Legal Services or one of the other places that I mentioned in Asheville. But it's the same way across the state. With Council on Aging, Blue Ridge Health Care, and a couple of other places. throughout. And we service 6 counties, and I think Council on Aging is servicing 12 counties. And so, but that number would get you into anywhere that you want to go in the state of North Carolina.
All right, so one more question before Keenan moves on. For those who are not in the state of North Carolina, where would they find the 1-800 Navigator number for their state?
That number is good for any state.
Okay.
It's a federal 800 number.
Okay, great. Keenan?
Right. All right. So, trying to wrap this up, Mrs. Caldwell, I think we talked about pretty much got a lot covered, but I wanted one final question from my end was about the cost. Now, I think you said something about $95, but from what I've been hearing, I know people were saying at the end of the year, like, for example, if they don't enroll, then it'll be $365 that'll be taken out of their taxes, and then that'll be for adults, and then half of that will be for children. I want to make sure we got that cleared up. And then also I wanted to I wanted you to let folks know as well what happens if they miss this enrollment fee, which they should not, this enrollment process on March 31st, the options that they'll have after that.
Okay. Let me say again up front that if they will call, if they will go in and talk with the navigator, the majority of the people will not have to worry about the fees, the majority. But those who choose not to enroll, if they have an income, this is the other thing. If you're going to file a tax return in 2015 for 2014, those are the people that this is going to affect. If you're going to file a tax return in 2014 for 2015 for 2014, you're the ones that are going to have to deal with a possible penalty. If that penalty is assessed, and it will be assessed if you don't get enrolled by March 31, the next time you will have the opportunity to enroll will be October 14 this year, and that will be for the 2015 year. If you don't enroll, and yes, those $95 or 1% will be the penalty this year for 2014, not 2013, 2014, which you will file for in 2015. If you don't enroll in beginning October 2014 into March 2015, then the penalty increases to $365. I think it's $362.50 in the next year. Each year it increases. Basically, what they're trying to get people to do is enroll in health care, and so that they have coverage. Now, one thing that we need to realize is that somebody is paying those hospital and doctor bills. If people don't enroll, and if they have no coverage, then the average taxpayer who is working and making money and paying taxes, that's who's paying for the hospital bills and doctor bills of people who refuse to, who have not at this point been able to have insurance. But now that they have it available to them and they're refusing it, then the average employee is the one that's covering their hospital doctor bills. And so basically they're only saying if you have insurance available to you, all they're doing is asking you to see if you qualify, see if you can have it, and then see if you can afford it. And if you can't afford it, in so many other cases, the government will help to pay those fees so that your minimal out-of-pocket cost-sharing amount is very small.
Wow, Keenan, we're going to have to definitely have her back because this is a very, very important issue. I had a few questions, but I'm going to reserve them. We want to make sure we have you back, Ms. Caldwell, to make sure that we can get the message out thoroughly. So please, by all means, stay in touch with us, with Keenan, of course, and we hope that if anyone has any questions, let me say this, Keenan, before I turn it back over to you. We want you to reach out to Keenan Lake on Facebook. If you have specific questions, inbox those questions to Keenan Lake, and by all means, we'll have Diane back on the show so that she can help answer some of those questions. But again, before we turn it back over to the host, 1-855-733-3711 is the significant number that you must call so that you can connect with a navigator for guidance in this process. By all means, you want to be guided in this process. Keenan?
Well, listen, folks, again, I want to thank you guys for tuning in to another episode of the Keenan Lake Show. I want to thank our guest, Mrs. Diane Caldwell, for the information that she shared. And again, we will get Mrs. Diane Caldwell back on the show again before that enrollment fee date so we can continue to get the word out. And so if we do have any questions from our guests, our audience, they can actually do what Coach said. Inbox me. I'm going to give you all of my contact information. First of all, I'm on Facebook, Keenan Lake. My daddy taught me that, and the Keenan Lake Show on SIBN Radio. Those are all three of my Facebook pages. I'm on Twitter, at the KL Show. And if you for some chance you don't have Twitter, you don't have Facebook, you can always go to the website, www.mydaddytaughtmethat.com, and you can reach out to me on that as well. Any questions, folks? Anybody has any questions? Anyone has any need for information? Inbox me, let me know, and we will definitely get the right folks to get in touch with you. Mrs. Caldwell, again, we want to thank you for being on the air and for sharing so much information, so much needed information. And so hopefully our listeners and our people who tune in will be able to get this information and put it to some good use.
Okay, I thank you, Keenan, for allowing me to be on. And I will email you, probably email you, because one of the things that I'm sure most people will want to know is what are the income guidelines for their particular situation. And I have that, from a single person to a 4-person family. And for instance, a single person, 11,000 up to 45,000, you qualify for assistance, government subsidy. And I have those numbers, and your people, you might be able to put it on your Facebook pages, and people will be able to go on there and take a quick look and see whether or not they need to do that, and then find out what the coverage would be for their particular income group.
That's a great idea. In fact, Mrs. Caldwell, if you email me that, I will definitely post it on the Facebook pages.
Okay, well, I will do that tomorrow and make sure you have it. And again, I really appreciate being on your show. The thing is to get this information out to as many people as possible. So I am truly appreciative for this particular opportunity. And anytime you want me back, I'll be glad to come.
Oh, man, thank you so much. Well, again, folks, we thank you for tuning in to another episode of the Keenan Lake Show. Tune in every Sunday, 4 p.m. We look forward to having you again, Coach.
All right, you guys, thank you again. As you said, live and on demand, the Keenan Lake Show on SIBN Radio is here to serve you. And if you have any further questions or inquiries about today's topic, by all means, Keenan, give them the Twitter and the Facebook one more time.
Twitter, at the KL Show. Facebook, Keenan Lake. My Daddy Taught Me That. And the Keenan Lake Show on SIBN Radio. And finally, the website, www.mydaddytaughtmethat.com.
All right, that's a wrap. You've been listening to the Keenan Lake Show on SIBN Radio. Until next time, take care of yourself. You guys, stand by.
You're listening to the sounds of your lifestyle improvement station.
Hi, Jamaica Chapel, College Park, Georgia, in the house. You're listening to SIBN Radio.
Hi, this is Ted Bones calling from Richmond, Virginia, and you're listening to the Lifestyle Improvement Station, SIBN Radio. Y'all turn it up now.
Hi, this is VJ Washington calling from Atlanta, Georgia. You're listening to the Lifestyle Improvement Station, SIBN Radio. So turn it up.
Hi, my name is Sonia Claiborne from East St. Louis, Illinois, by way of Carruthersville, Missouri. You're listening to the Lifestyle Improvement Station, SIBN Radio. Turn it up.
What's good? It's your boy Joe coming from Snellville, Georgia. You're listening to the Lifestyle Improvement Station, SIBN Radio. Y'all turn it up.
You're listening to the sounds of your Lifestyle Improvement Station, changing the way we live. SIBN FM, powered by Select USA TV.
Thank you for joining us today for the Keenan Lake Show. We know you will be empowered as you consider the content shared by Mr. Keenan Lake, co-host Marcus Select, and our guests. For more information about Mr. Keenan Lake, please visit www.mydaddytaughtmethat, and feel free to email us at lake@mydaddytaughtmethat.com. Books can be ordered from Mr. Lake by calling 828-582-2261. Until next time, you've been listening to the Keenan Lake Show on SIBN Radio.